So I wanted to kind of get into the actual payer-to-payer data exchange cohort program that Availity launched last year. So can you tell me a little bit about that initiative, its structure, and what its ultimate goals were?
Absolutely. I'd love to talk about our cohort. And, I love to talk about this particular topic because as a product leader, it's so important to me to have customers at the table with you when you're building new solutions. And we've had such a collaborative group of health plan partners. They've been absolutely fantastic innovators with us. And this idea was really born not too long after the proposed payer-to-payer mandate was released. And at Availity, I joined Availity a little over 2 years ago, and it's been such a joy being a part of Availity because I think in no other organization across the healthcare ecosystem really understands the complexity of trying to facilitate data exchange across multiple different data standards, types, and organizations. And in addition to that, we have such an extensive network of payer customers and are already facilitating billions of transactions across health plans today. And so, at the time of the proposed ruling that came out, one of our customers came to us and asked whether, given our large payer customer base, were we thinking about, being able to help facilitate a more centralized hub, a one-to-many connection point designed to support health plans exchange data. And we thought that idea made complete sense given, Avality's broad health plan customer base, as well as just our own involvement within exchanging information between healthcare stakeholders. And so Availity, we officially initiated our payer-to-payer cohort in August of 2023, so a little over a year ago, and we embarked on this really dynamic partnership with a select cohort of payers to really pioneer and establish, what we think of as the inaugural set of payer connections within our connectivity hub. So over the course of 8 months, we met weekly, and we orchestrated recurring workshops uniting technical teams from each health plan. And these gatherings were really dedicated to exploring strategies and different ways to consider executing the payer-to-payer data exchange. And so we had participants engage in discussions covering, their organization's overarching interoperability strategy, resources involved for implementation and testing, sharing valuable lessons learned to foster adoption and promote success. And the goal of the cohort was really to address two fundamental questions. First, uncover any hidden challenges or pitfalls associated with pair to pair connections. And second, determine the most effective and repeatable process for establishing connections with other health plans.
So I imagine as you made your way through this process, there were challenges and opportunities that you had anticipated. But I wanted to ask, what challenges kind of came out of left field? Was
Mhm.
anything that happened that you were just not expecting initially?
We definitely encountered challenges, and that was a great part about the cohort too. Is we had multiple health plans at the table with us, solutioning and working through those challenges. And I alluded earlier in our conversation that while there are implementation guides to help guide pair to pair connectivity efforts, the guides only get you so far because there are gaps in them. And so just to name a few of the challenges we encountered, specifically for payer-to-payer, the Da Vinci PDEX implementation guide, it essentially serves as a use case implementation roadmap for health plans who are looking to navigate that process of facilitating payer-to-payer data exchange. But in our experience working with these guides and working with our health plan customers who have attempted to establish real-world connections, we encountered hidden, unanticipated challenges that the guides did not address. So for example, there were dead links. So several references within the guides led to non-existent pages, and that caused navigational issues and in general made more of a comprehensive understanding of implementation challenging. But there also were discrepancies between the PDEX implementation guide and the actual mandate, and this is kind of known in the industry. But for example, version 1 of the guide mandated that members possess credentials with both their new and old payers, but the CMS mandate dictated that members only need credentials with their new payer, which then, communicates directly with the old payer. So, what do you do in these situations? And again, that was the real value. Our mission at Availity, I think, is really driving multi-payer solutions, and a real value add of our payer-to-payer cohort was again that we could take these ambiguities and really drive consensus and alignment across our health plan customers to clarify those ambiguities. Thinking of another unforeseen challenge, we found that also proved helpful to really talk through with our cohort of payers was the challenge around health plan authentication. So in building out our payer-to-payer connectivity solution with the set of health plan customers, questions emerged from our health plans of, how do you vet that requests coming into them are from legitimate sources or good actors? There's a lot of bad actors out there. There's a lot in light of, recent security breaches. There's a lot of concern around making sure that, what we are doing is we're doing in a very safe way when we're looking to exchange information, especially when it is personal health information. And that's something we decided to take on as a part of our payer-to-payer connectivity hub value is that Availity will validate payers so that any customer of ours can trust that requests coming in through our network are valid and legitimate. And so for payers not leveraging our solution, thinking through how do you authenticate and validate requesters to ensure who they are is actually who they are is really, really important.